Well, I had the unique honour of being the first president of the ASMS and hence had a lot of responsibility coupled with colleagues in setting up the union, establishing a membership and setting future direction, and including employing the most important person we have on board, Ian Powell. The times are difficult. We were charting uncharted waters and hence floundered on occasion, but mostly I believe set a direction which is illustrated by today, 25 years later.
With consolidating the gains that have been made in the previous 2 or 3 years, as George said this morning, we had been involved in a lot of negotiations starting very soon after the union was formed. And so that was a large part of what we were doing, was continuing to try and advance the working conditions, particularly to rule out the disparities between different specialties, which had become very marked in the early 90s.
The political situation was somewhat anti the Senior Doctors Union, and so there was a lot of conflict between us and the government. There was always in the background, there were constant negotiations that were fraught, but at the same time we were coming together as a group of people who were talking about values rather than just our pay and conditions. We were pursuing values and we stood up for those. And one of the best stories I could give is when Bill English was the Minister of Health, and David Jones got up with his sonorous Welsh voice, and he asked a question, and I, as the president sitting next to Bill English, noticed that he began to quiver. And then when I shook his hand was sweaty. And we had reached into the heart of the people who were making the decisions, and they realized that senior doctors weren't supporting much of what they were doing. So we had a voice, and we began to speak with a louder and a more consistent expression of what it was that we were there for. And it wasn't just about whether we were getting paid more, it was also about the system we were trying to support.
I think over that 10 years, the move to reclaim clinical leadership was the most significant achievement of ASMS. That took a lot of teamwork, a lot of opportunism. It took grabbing coalitions of the willing. It took getting in rooms with people and having some very hard conversations. But in the end, we had managers of the health system, administrators of the health system, politicians and clinicians all agreeing that the only way forward was clinical leadership. The difficulty has been in the implementation.
The challenge in secondary and tertiary care at the moment is, I think we all realise that we need to move more towards prevention rather than cure, but the problem at the moment is that we're all very busy bailing water out of the boat and trying to stay afloat. So trying to find the time and the headspace to actually move into a prevention mode is sometimes very difficult. It'll be great if we can find the spare time and the opportunities to actually do move more towards prevention. As a paediatrician, my measure of success is an empty hospital bed. I think if we can achieve that, then I've done my job. But at the moment, we're struggling with hospital beds that keep filling up.
That's actually a very difficult question to answer. There have been many achievements, and the one is just to be such a powerful organisation 25 years later, recognised in all quarters as influential. But part of it is looking after the wages, salaries of our members, which is fundamental, but maintaining a very solid commitment to professionalism, to the interests of the population, the health of the population, the patient as being central to our theme.
I think reputation is one of the great achievements, particularly amongst the workforce, and I think amongst the public as well. And reputation is a currency that is tradable, and it is something to be looked after extraordinarily carefully, and it's something that can only be built over a long period of time. The ASMS have got a great reputation, there's no question about that. They still get the brickbats from the politicians, but we've got the same old system of politicians that we've always had, and I doubt that that's ever going to change. But the the potential for the association to take an increasingly great role in setting policy advice and setting the minds of the public towards certain issues, I think is the foundation is well laid.
I think that we became relevant to the senior medical workforce, so that our numbers just grew every year. That was one part of it. The other, we were also very relevant to the union movement as a whole. And so we had very good relationships with the CTU and became a highly valued union, which for professionals who doubted the worth of unions was a huge change.
Well, I think that voice is a very important aspect of it. But the other thing that we've been able to do is we've been able to move on to a group of people who can function in a fast-changing field such as medicine. We can go off to our meetings, and the CME agreements that we've made with our employers, I think was one of the best things, without a doubt.
The challenge is to hold on to this two-edged reason for being. One is to improve the conditions of our members so that they can look after themselves and they can look after the health system. And the corollary, obviously, is to be the champion of the public health system, because many times over the last 25 years, it seems as if no one else has been that champion. And it is quite apparent that as the squeeze goes on more and more, we in ASMS have the history of the last 25 years and the potential over the next 25 years to be that true champion.
In my 25 years of being a specialist in hospitals, things have changed enormously. And I wonder if that points to a new direction of interest for the association in its next 25 years. Certainly in my time as an intensive care doctor, treating young people from accidents and acute illness, that was my bread and butter. Today, my bread and butter is largely about treating preventable complications of preventable chronic disease. And we have a very sophisticated system to treat disease in this country. We absolutely need as sophisticated a system to prevent disease. And that perhaps is the direction in which I think the association should turn its mind. Now, being as mature as it is, I think it can stretch out beyond the hospital services to the preload that drives the hospital services business.
Well, it was quite interesting listening to the history that George Downward sort of gave us and looking back and see where we've come from. And we've obviously come a long way. And the other thing that I realized is that I think we're on the right track. We just need to keep going and keep looking after the workforce, keep promoting and looking after the public health system, and do that in a more concerted way. And holding hands with other unions and organizations that's really got the same aim and the same outcome that we would like.